board of supervisors. It's always appreciate the opportunity to provide updates on our operations, and as many probably are aware, or at least as of yesterday at 4, we have suspended our investigations and contact tracing, given just the enormous amount of cases that we've seen. Over the past week, or last week, we had roughly about 1,400 cases reported to us, and this is an extremely dramatic increase. Just alone yesterday and today, we had roughly 200 plus cases reported to us, and this morning we had about 354 cases. So we are just at an unsustainable amount of contact tracing and disease investigation. So at this point, we're not really able to keep up with that. As we've described before, that contact tracing is like playing phone tag, and we all know that as those numbers get higher, it gets exponentially harder to keep up and to do that, and to do it well, to provide that information. So as Danielle had mentioned last week, as we've done in the past, we are shifting to more of an education approach so that we can get the information out to folks as quickly as possible and post that. So we're putting extra emphasis on education, on social media, online, print, and other work groups that we've stood up throughout the pandemic to be able to get that information, because we know that just within the past week and a half, much has changed. And I'll be able to go through the highlights of those changes briefly. I do want to note that it comes at a hard decision to do that, because there's a desire to keep going. But I think overall, we know that we've bought time since the beginning, and as vaccines have been provided to the majority of the public, we bought everyone time to get the best protection possible. So we will be emphasizing that as much as possible, because we know it's changed.